This episode of Precision Opinions Live is brought to you by Vintage Labs. Vintage Labs is a professional-grade supplement and cosmetic company where each product is tested and reviewed by one of their exclusive pharmacists. Look for the pharmacist's signature on every package that ensures that the active ingredient falls within 5% of error and does not contain arsenic, lead, cadmium, or mercury. We welcome you to join the Vintage Labs collection, where they do the research for your health. Use promotional code LIVE, that's L-I-V-E, to receive a 10% discount on all orders at vintagelabscollection.com.
Hi, my name is Nicole from Precision Compounding Pharmacy, and on this episode of Precision Opinions Live, I'm going to be introducing Dr. Scott Smith and pharmacist in charge, Stella. This episode is going to be going over telehealth treatment options. So first, I'm going to introduce Dr. Scott Smith, who is a board-certified family medicine physician, and he's well-trained in cognitive behavioral therapy, and he's well-recognized for his kind and perceptive bedside manner. He attained his medical degree from the Medical College of Georgia. And after that, he completed a 3-year residency in family medicine from South Regional Memorial Hospital in Greenwood, South Carolina. For decades, he worked as an emergency room and primary care physician and has a great deal of experience helping people with anxiety, depression, mood disorders, and PTSD. And he's very passionate about treating mental health problems as long as physical disorders. He is most helpful to treat people with a combination of counseling and medication to help people move forward and live the life that they desire. And he's fully invested in each patient's journey toward happiness. So without further ado, I'd like to introduce Dr. Scott Smith and Stella.
Okay, so we're here for Mental Health Awareness Month, and we're doing an episode series for Precision Opinions Live, and I'm here today with Dr. Smith. Dr. Smith, thank you for coming on. I really appreciate it.
Well, I'm so glad to be here. Thank you for including me.
Awesome. So pretty much full detail and disclosure on this video series is we're going to Precision Opinions, Precision Compounding Pharmacy and Wellness will be donating all the tributes, and each view will be allowed a dollar amount over a month span, and we will be donating that to NAMI, which is the National Alliance of Mental Illness, that supports mental health. So pretty much Dr. Smith is huge in the telehealth angle of mental health. So I wanted to have him on to kind of discuss the availability of seeing a physician now over the phone or over Zoom, or just like we're speaking to each other right now. So it's a lot more, it's hard to find someone to speak to about your mental health, but it's easier nowadays when you have telehealth. So I wanted to get into that a little bit, but before we get into that, I wanted to ask Dr. Smith, because he's doing ketamine therapy, which is an emerging field of mental health right now. So pretty much I wanted to get his background and get your background on specific how you got into ketamine, how you learned about it, and how you became the guru of ketamine.
Anxiety and depression runs in my family. And when I was in medical school and I was a medical student, I was signed up to be a psychiatrist. And I had done psychiatry research and I had a psychiatry advisor. And at the very last minute, I got cold feet. And I changed my mind and went into family medicine. A friend of mine said, well, in family medicine, you take care of a lot of problems and you'll take care of people with anxiety and depression. And he was right. That was a good decision. So for my entire career, I've been helping people with anxiety and depression problems. When I was a young doctor, Prozac was discovered. And I remembered the way that they talked about it. They talked about it like, well, what are we going to do now? Because this medicine's going to end depression. And it helps a lot with depression. And there are a lot of medicines that help with depression. But there's a significant number of people that use those medicines and they have side effects. and they can't take them, or they use those medicines and they just don't work for them. And so those medicines don't work for everybody. Ketamine is a medicine that's an alternative treatment for people that have been treated with a lot of other medicines for depression and they've not been successful. And for other problems, ketamine can be real helpful for addiction problems and some specific mental health problems, just not resistant depression. Mm-hmm. And so before I knew anything about ketamine, for the first 5 years of my career, I actually worked in the emergency room. And ketamine was a medicine that I used. It's used in the operating room. And in the emergency room, I would use it on children like 3 years old, 5 years old, for children that had injuries and they needed a procedure, or if we had to set a broken bone. It's a medicine that can be administered in a shot, and then you can do a procedure and anesthetize children. And so I was very familiar with it, but only within that kind of format. And so on down the road later in my career, when I was working as a family medicine doctor, one day I was driving to work and there was a story on NPR about using ketamine for depression. And I heard that story and I thought, that's the dumbest thing I've ever heard. That medicine would never help anybody for depression. I used that medicine to do surgical procedures. And when I got to the office, 3 of my patients called me and said, hey, I just heard this story on NPR about ketamine. Can you treat me with that medicine? And I said, well, I'll research this because I didn't know anything about it. And so the more research that I did, the more I became convinced that there was science behind this and that it was a legitimate treatment. And so I started taking steps to be able to treat people with the medicine. And then at that same time, my wife had been having problems with depression for about 20 years. And she'd seen 6 or 7 doctors and she'd been treated with almost every medicine. And when I talked to her about it, we thought maybe that would be helpful. And so she went and saw a doctor and was treated with ketamine infusions, and it worked. And no other medicine had helped her before. And so after her treatments, we were talking about it and we were saying, why does this cost so much money? And why can't you go see your family doctor for this treatment? And so when she got better, she actually went back to school at the age of 50 and became trained as a medical assistant. And we opened up an office here in Charleston, South Carolina, to treat people with ketamine. But we opened up our office 2 weeks before the pandemic started. And so we ended up not seeing many people in the office. But to make a long story short, many, many people started to contact us from the internet. And this was at a time during the pandemic when treatment centers were closing down and people couldn't go see the doctor. And there wasn't anything available. And there were nothing existed for treating people over the telephone this way. And so we, based on the science, and based on studies that had been done, we kind of formulated a protocol to treat people at home with sublingual ketamine, basing it on the doses that are used in the office and trying to make the dose the equivalent of what it would be when people are treated in the office, but to use at home. And the way that ketamine is absorbed sublingually is very safe. It's much different than when it's administered in the office. And so we use a dose of ketamine that's called a subdissociative dose. It's a very low dose. And the science says when people take this low dose on a regular basis, it can help with anxiety and depression. And what we learned over 2 years of treating people during the pandemic, treating about 1,200 people, is that this medicine works at home just as well as it does in the office for the vast majority of people. And doing it that way, it costs much less. And it's much more convenient because people don't have to miss a day of work to go to the doctor's office. They don't have to get somebody to drive them home, which doesn't sound like a big deal. But when you have to take off work to drive, your loved one home from the doctor's office a couple of times a week, that's a big deal. And so this is a way that people can use this medicine in the comfort and the privacy of their own home. The response rate in the general population is about 50 to 60%. And so when people have symptoms that ketamine would help, it makes all the sense in the world to treat them for a 30-day period to see if they have a positive response. And so that's what we do. And now we closed our brick and mortar office that we opened last year in October because we were being so overwhelmed with requests from the internet for help. And now that's what we do full time. And we're seeing so many people now that we're having to hire a new person every 2 months to help with the follow-up. And so this is a really new concept. We're still a doctor's office, but we exist on the internet. And every state where somebody contacts me from, I become licensed in that state so I can provide care for them. So it's like a new revolutionary concept where I'm a family medicine doctor that has unique training to provide this special service. And I have the ability to reach into almost all 50 states so people can be a patient in my practice. And so when they contact me, they become a patient in my practice. We're not some big faceless internet company. They're doctors, Dr. Smith, and they talk to me. And then we have a multidisciplinary team that we're building to take care of people because I feel like there's more needed to recover from depression and anxiety and PTSD than just taking the medicine. And so we actually have a therapist on staff that does ketamine-assisted psychotherapy, which is a kind of treatment that's a gold standard for post-traumatic stress disorder. We have people that have recovered from anxiety and depression by using ketamine. And then when they got better, they became trained as a life coach, and now they help other people. And so they work with us and they help do follow-up visits.
Oh, I love that. Honestly, it's so refreshing to hear that whole story. And, because it's honest, it's truth, and no one could have ever planned for this pandemic. So you think about what happened in medicine, and everyone kind of changed as far as the way they were practicing.
There were some good
stories.
Yeah, so there were some good things that happened during the pandemic, and this is one of them. And so before the pandemic, this was not even legal. Because of the opiate crisis, some of the way that legislators and lawmakers overreacted to the opiate crisis was they made it against the law to treat anybody in another state with any controlled substance because of the opiate crisis. Ketamine's a controlled substance because there's an addiction potential with it. It's very low. It's very out of the ordinary, but it's entirely appropriate that it's listed as a controlled substance by the government. But it was kind of they threw out the baby with the bathwater kind of situation. Yeah. Because what we're able to do now is there are areas of the country, our country has vast, huge parts like Montana and South Dakota, and there are not very many doctors, but there are people there with resistant depression and they're suicidally depressed and they don't have access to care. And this telemedicine allows them to see me, and it allows me to reach across the miles to be able to help them. And it's just been a blessing. It's an absolute blessing because we are very happy with what we're doing. We're very happy to help other people the way that we've been helped. And so we're kind of on a mission. It's a little bit more than just like a internet company that treats people with ketamine.
Yeah, there's a man behind the website, and
there's more than just a man. There's many other people, and so there's members of my family that help with this. You know, I'm working in direct collaboration with my wife to help people, and so it's the best part of my career.
Good. Oh, I love it. Love it. So yeah, to add to your point, like where our pharmacy is right outside New York City, and even speaking about the most populated city in the United States, there's not enough ketamine treatment centers. So for someone in Montana, how are they going to find help like this? You know, and if they're not doing well, not saying anything bad about SSRIs, SNRIs, they're not doing good on them, they have no other options. And now you're providing that to them, which
Right.
is fantastic.
And so the internet has really helped facilitate this. It's a really amazing thing. And so I became interested in hanging out on the internet because I'm kind of a nerdy guy and I do a lot of nerdy computer
Tell
stuff.
the viewers what your favorite website is.
Oh, my favorite website is Reddit. I like to read about the news on there. And if your toilet's broken and you don't know how to fix it, there's a subreddit about how to fix your toilet. And so all kind of great information. And what I was going to say is I met a lot of people that play the computer games that I play, and we can hang out and be nerdy and talk about it. And then I realized there's subreddits for depression, and there's subreddits for people that have depression and they're not getting better. And I spend a lot of time on there talking to people and giving advice about treatment for anxiety and depression. And if it hadn't been for that website, I wouldn't be doing this right now, because it was people on that website. When the pandemic occurred, they explained to me that the laws had changed and it was actually legal. And they encouraged me to do this. So I owe them a great debt of thanks. Thank you, Reddit.
Thank you, Reddit. So Dr. Smith wants to give a big shout out and a thank you to Reddit. Yeah, so I think it'll be nice if you explained your full backstory, and I love that. And can you explain kind of what a patient would go through that's doing a visit with Dr. Smith? What happens when they find you on, let's just say, Reddit, and they find you in there and they set up an appointment? What's that like for the patient?
What they would do is they could go to our website, and there's an ability there to make an appointment. And you can just go to the website and make an appointment, or you can call our office and set up an appointment. We have an electronic medical record that has an app that they can download on their phone. And so all the information that you would sit in the doctor's waiting room and fill out all those pages of paper, you can just do that on your phone. And then there are some surveys about anxiety, depression, PTSD symptoms, suicidal feeling questions, and you can answer all those in the comfort and the privacy of your own home. And then all of that's put in your medical record, and it's private. I'm the only person that sees it, and I'm able to review that information before your visit. And then at the time of your visit, I send a text to your phone, and you follow the link on your phone, and it pops you into an audio visual visit like this. And all of our visits are 30 minutes long. And so I'm a very friendly, nice doctor. I like talking to people. I like to get to know a person for 5 or 10 minutes first and just talk about their life and what they do. And then we talk about, why are you here to see me? What am I helping you with today? And then depending on what their symptoms are, we'll talk about their treatment.
Awesome.
If they have symptoms that ketamine can help with, then I'll either send a prescription to their local compounding pharmacy, or if they're in an area of the country where there are no pharmacies, then your services have been very helpful for that. So you're helping people, you're saving lives. There are people that are suicidally depressed that are in parts of the country that don't have access to care, and they can have a visit with me, and then they get the medicine from a pharmacy like Precision Pharmacy sent to them in the mail. And like I said, the response rate in the general population is 50 to 60%. And so this medicine's very helpful for people. Mm-hmm. And then we would start them on the medicine, and they follow up with us every 30 days. This medicine is a controlled substance, and so we need to meet with people on a 30-day basis. And people are taken care of by a treatment team. And so they don't see me every time. They'll see a therapist. We have a therapist on staff. We have life coaches. And we have people that have been where they've been and gotten better. And not only have they gotten better, they've received training to help people. And so we prefer to hire people that have a background of anxiety and depression because they can relate. And that experience is something you can't teach in school. That's almost more valuable sometimes than book learning.
So question now, if a patient wants to see a therapist more than every 30 days, is that an option?
We're still working on that. And so the roadblock with that is that a therapist has to be licensed in that state. And so for myself to become licensed as a physician in like over 40 states, that's going on 2 years. That was a 2-year complicated process. And it costs a lot of money. I mean, it's cost over $100,000 for me to become licensed in all these states. So it's really expensive. So we're trying to figure that out. And what's happening is we're kind of setting up an organic network of therapists in each state that want to help this way. And they can follow up with a therapist in their own state, and I'll prescribe the medicine and supervise. So there's not a formal network set up yet. There's some people on the internet trying to monetize this and charge people money to have access to that kind of care. But what we're trying to do is just do this organically with therapists that contact us. And so that's kind of a work in progress, and we'll have more about that on our website in the future.
Awesome. And then kind of the last question that I had for you is the evolution of telehealth.
Mm-hmm.
Where do you see it going in the future? Do you see it growing and being something that people only refer to telehealth? Do you see it becoming a large source of our country's health? Where do you see it?
I think it can be very helpful, and there's a lot of places where a lot of situations where people would never imagine that telehealth could be helpful in that situation. Like the first thing I think of is when people are hospitalized and then they're sent home. There's going to be monitoring equipment that's manufactured in the future that will be able to monitor people's vital signs and transmit that directly to the doctor, to the medical team. And so what's going to happen is your bedroom is going to be an extension of the hospital network in your area. So that if you're hospitalized for an injury or an illness, you'll be able to go home earlier to the comfort of your own bedroom, your own bed, and you can be monitored there, and medical personnel will come and visit with you an hour or two a day. That's the future of medicine. And so there's going to be patient monitoring devices that might become something that everybody owns. Just like everybody has a television, and that used to be unthinkable. And then now everybody has a cell phone, and you think of the power, the computing power in a cell phone. You know, commonly people talk about it as being more powerful than the computers that were used to land men on the moon. And everybody has that in their pocket now. There's going to come a day where you have a device in your bedroom that monitors all your vital signs and your well-being wirelessly on a daily basis. Wow. And that information could be transmitted to a physician. And so that's pie in the sky, but that's going to happen. And then just as this being a force multiplier. And so one of the things that happened during the pandemic is people were very sick with breathing problems from COVID, and a lot of people had to be hospitalized on respirators. And in most hospitals, there's one doctor to take care of all the patients on respirators. And then when a ward becomes full with 30 or 40 people on ventilator machines, there's no way one doctor can take care of that. And so what they realized is this doctor can supervise other individuals that are specially trained. And we can use monitoring equipment so that the doctor can be in a different part of the hospital and have eyes on the patient. And he'll come by and round once a day, but he's supervising other people that are doing the actual work. And that's a huge force multiplier. So instead of one doctor during the pandemic only being able to take care of 5 or 10 people on a ventilator, it was a new way came up to do that. And the same thing will happen with telemedicine. And so telemedicine allows a doctor to have eyes on when he's in a different part of the hospital, when he's in a different part of the city, when he's in a different part of the state. And so there's going to be careers for people in healthcare that are hands-on people that are force multipliers for a doctor who's doing specialty care, and they'll be coming into your home.
It's wild. And now that you just mentioned that, I think to like the Apple Watches and the people with the Whoops and all of these new devices, it's entering into this new phase of monitoring. I love it.
And some of that'll be really good, and some of that'll be a little bit not so awesome, because like one of the hospitals I worked at required for health insurance required all of the employees, me included, to wear a exercise monitoring device.
Wow. Yeah.
And so that's a little bit scary. So it's like my doctor's going to know if I'm actually taking my medicine every day.
Yeah. Yeah.
Because you're a pharmacist. What are the numbers about the number of people that get a prescription and then don't end up taking it?
Oh, it's about, I would say it's about half. I don't know the actual statistics right now, but they actually, and you know this too, hospitals have teams of people. And when we go into hospitals during our residencies or our rotations, we're physically trying to stop readmissions. So we're making sure that the patients are compliant on their medication. That's part of a regular pharmacist consultation process. You know what I mean? And
right.
It's wild, so.
Yeah, and so they'll probably be monitoring devices that can tell the doctor if you're taking your medicine or not. And so that's a really important thing, though. If 50% of people aren't taking their medicine, what a simple thing to help remind people to take the medicines that they're supposed to be taking to prevent them from getting sick. So in the end, those are all going to be good things. It's going to be a lot of change. It'll be a world where people are healthier.
Yeah.
And it'll be more convenient. It'll be so much more convenient. I mean, when I feel sick, when I feel really bad, I want to get in my bed.
You don't want to put a gown on and go to an IV in your arm,
Right. So that part will be a lot better.
Mm-hmm. Yeah. So, Dr. Smith, thank you so much. I appreciate your time. I appreciate your knowledge, and I'm sure the internet's going to love your story because that was fascinating. So if folks out there wanted to contact Dr. Smith, how do they do that?
Sure. Like I said, I had an old brick and mortar office, and it was called Smith Family MD. And so we still have our old website, smithfamilymd.com. And then for our internet ketamine services, the name of the website is smithketamineservices.com. And so you can go to our website, and we've got a lot of information posted there. One of the things that we believe in is having a live human being to answer the phone. And so it always really bums me out when I try to call my doctor and you get that phone tree. And so we have a person on the West Coast answering the phone and a person on the East Coast answering the phone. And so people are welcome to call our office at 843-972-8136. And it's like an old-fashioned relic. There's actually a person that's friendly and will talk to you.
Real human. Oh, man. All right. Well, thank you so much for coming on. I really appreciate your time.
It's been a pleasure.